Mammary ductogram or galactogram, single duct, RSI. Multiple ducts, RSI. The physician performs an injection procedure for mammary ductogram or galactogram. A needle and cannula are inserted into the duct of the breast. Contrast medium is introduced into the breast duct for the radiographic visualization. A dissecting microscope may be used to aid in placing the cannula. The needle and cannula are removed when the study is complete. Digital breast tomosynthesis, unilateral, bilateral. Screening digital breast tomosynthesis, bilateral. Digital breast tomosynthesis technology, DBT, is rapidly being implemented as it provides a higher diagnostic accuracy compared to conventional mammography. It is also referred to as three-dimensional, 3D, mammography, which creates a three-dimensional picture of the breast from many angles using low-dose X-rays. The breast is positioned in a similar fashion to a conventional mammogram, with slightly less compression, while a scanner rotates around the breast in an arc formation. Several images, usually between 10 and 15, are taken over approximately 7 seconds. While more images are taken, DBT does not require any more radiation than conventional mammography. Once the images have been taken, computer programs produce clear and highly focused 3D representations of the breast that the radiologist can then view as thin layers of breast tissue, similar to CT scan images. Diagnostic mammography, including computer-aided detection, CAD, when performed, unilateral, bilateral. Diagnostic mammography is a radiographic technique used to diagnose breast cysts or tumors in women with symptoms of breast disease. Mammography is done using a different type of X-ray than is used for routine exams that do not penetrate tissue as easily. The breast is compressed firmly between two planes and pictures are taken. This spreads the tissue and allows for a lower X-ray dose. When performed in conjunction with a diagnostic mammogram, computer-aided detection, CAD, utilizes the X-ray taken of the breast, scans the analog mammography film with a laser beam, and analyzes the video display for suspicious areas, most often converting it into digital data for the computer first. The patient does not need to be present for the CAD process. Report 77,065 for a unilateral diagnostic mammogram including CAD, when performed, and 77,066 when performed on both breasts. Screening mammography, bilateral, two-view study of each breast, including computer-aided detection, CAD, when performed. Screening bilateral mammography is a radiographic technique used to detect breast cysts or tumors before they are palpable in women who are asymptomatic. Mammography is done using a different type of X-ray than is used for routine exams that do not penetrate tissue as easily. The breasts are compressed firmly between two planes and two views of each breast are taken. The planes spread the breast tissue and allows for a lower X-ray dose. When performed in conjunction with a screening mammogram, computer-aided detection, CAD, utilizes the X-ray taken of the breasts, scans the analog mammography film with a laser beam, and analyzes the video display for any suspicious areas, most often converting it into digital data for the computer first. The patient does not need to be present for the CAD process. Complex dynamic pharyngeal and speech evaluation by cine or video recording. A radiologic study is performed for pharyngeal and speech evaluation. Cineradiography, or video recording, is employed, as the physiologic event of speech and swallowing occur too rapidly for normal fluoroscopic viewing. High-speed frame rates are used to evaluate speech and swallowing, and later reviewed and interpreted by the radiologist. Discography, cervical or thoracic, RSI. Discography, lumbar, RSI. A discogram, also called discography, is an imaging test used to evaluate back pain. Individual intervertebral discs are imaged and examined in discography, also known as nucleography. Iodinated contrast medium is injected into the center of the disc. A series of images is taken by the radiologist and interpreted and reported. Cystography, minimum of 3 views, RSI. A catheter is inserted into the bladder and contrast medium is instilled using mild pressure injection. The catheter is clamped after the contrast medium has filled the bladder and the bladder is fully expanded. Films are taken to observe any medium that is outside the bladder. The bladder is next drained and more films may be taken to look for other evidence of rupture following the flow of contrast outside the bladder. Vasography, vesiculography, or epididymography, RSI. Methylene blue is injected into the vas to test for obstruction of the ejaculatory duct. If during cystoscopy, dye is seen, the ducts are patent and vesiculography may be obtained to further determine obstruction. The vas is approached through an incision in the scrotum. The testis is freed and the vas separated. After a catheter is threaded into the vas, saline or lactated ringers are instilled to determine patency or blockage. Flow resistance may require more formal vasography, with water-soluble contrast media instilled through a ureteral catheter fed to the seminal vesicles through a dilated vas. Epididymography requires taking images of the coiled tube connecting the testis to the vas deferens. This code reports the radiological supervision and interpretation for epididymography, vesiculography, or vasography. Urethrocytography, retrograde, RSI. Radiography of the urethra and bladder that utilizes a radiopaque substance. A radiographic exam of the urethra and bladder is performed using contrast material to diagnose strictures, obstructions, and abnormalities, or as postoperative function assessments. It is most often performed on males. A balloon catheter is threaded into the urethra and the balloon is inflated. Fluoroscopy is used to aid in injecting the contrast medium through the catheter. Films are taken to show the flow of contrast as it moves retrograde, against the normal flow, through the urethra and into certain parts of the bladder. The bladder is next drained and more images may be taken of the urethra. Urethrocytography, voiding, RSI. The patient first empties the bladder. A catheter is inserted through the urethra into the bladder and any excess fluid is drained. Contrast medium is slowly instilled until it fills the bladder while the flow is observed via fluoroscopy. Films may be taken if reflux of medium is seen backing into the ureters. Once voiding commences, the catheter is removed and the voiding function is imaged on films or video.